In this PhotoVoice assignment, we are going to be discussing drug abuse among the homeless population in the Regent Park area. The reason for such a large homeless population is that Toronto is the fifth most unaffordable city in the world. The average household income in the Regent Park area is between $44,000 and $54,000, while the average rent in Toronto is $2,270 a month. Royal Bank of Canada did research and found that the average household in Toronto would need to spend 80% of its income to cover the cost of owning a home. Currently, Regent Park has seen a huge loss of rental units due to property conversion for the revitalization program. People who cannot afford to go anywhere else are forced into shelters or to the streets. More than 100,000 people within the City of Toronto are on a waiting list for affordable housing. Drug abuse can be a cause and symptom of homelessness. Studies have shown that around 40% of the homeless population is abusing drugs or alcohol. The high amount of drug abuse is due to many factors. Some look for the release of stress. Others use it as a coping mechanism. Some use it for warmth due to the sensation that some drugs give the body. These are especially true on cold days. Some use it as medication. An example can be seen in people with depression and how they abuse alcohol. And some have mental illnesses that lead them to use it. The homeless population faces multiple health inequities according to the Public Health Ontario. Individuals that are homeless have an increased risk to nutrition deficiency, foot issues, hypertension, and injuries due to assault or theft. They have limited access to healthcare. When discharged from a hospital, they do not receive follow-up care or recovery support. They also have lack of access to dental care. All of these factors create a cyclic cycle to the issues the homeless population faces with health.
Currently, the issue of drug addiction in the homeless population is an increasing problem which healthcare members in Regent Park are trying to address. There are many support programs that the Regent Park Community Health Center provides to the homeless population, such as shower and laundry support, housing support workers who aid by providing resources and advocating for those that are homeless or at risk of homelessness, and also men and women's drop-in programs as a harm reduction space and social engagement environment. To battle the crisis of drug addiction, the Health Center provides harm reduction supplies and social support, as well as supervised injection services. For the community to stay safe, needle drop boxes have also been placed in key areas. In a study done to examine drug use in the homeless population, it was seen that drug use was associated with unmet healthcare needs and access to addiction treatment. This shows that supervised consumption facilities are vital and do in fact help with the problem of drug use in the homeless population, as they allow for access to services to prevent overdoses and safe drug use.
Although the interventions currently in effect are beneficial, additional interventions are required. Activists and healthcare experts agree there is a need to move from a criminal justice approach to a public health approach. Substance use disorders can be treated with evidence-based treatment and social supports. Criminal sanctions are ineffective at preventing or addressing substance use. Community health nursing services should be listening to the voices of people who use drugs when planning care for those people, to identify the needs of that community. The COVID-19 pandemic has negatively affected people who use drugs, and the Canadian Association of People Who Use Drugs, or CAPUD, is advocating for decriminalization, at least during the pandemic. Drug policy should follow public health principles, emphasizing social protection and health care instead of conviction and punishment. Illicit drugs are contaminated, and the toxic drug supply is responsible for countless deaths. In order to promote and preserve health, a safe supply of substances needs to be established. Nurses and other healthcare providers need to advocate for safe supply programs. For example, CAPUD advocates prescribing Dilaudid and Dexedrine as safe pharmaceutical alternatives to opioids and stimulants.